Hi, welcome back to RohrichKnose Podcast, helping you become a better you. I often get asked when I'm doing rhinoplasty, especially revision rhinoplasty, what do I use as grafts, especially when the grafts are missing or when there's no cartilage. So I like to use rib or your own septum, but often patients don't want me to use their own rib cartilage because it hurts, it's another donor site. So over a decade ago, I found this company called MTF that actually has incredible donor site cartilage, and it's fresh frozen rib. And I'm going to tell you a little bit about how I use it and why I use it and why I think it is superb, as good or better than your own rib, because there's no donor site. You can select any type of rib and shape you want and need. And the resorption, warping, infection rate is similar to that of what is from autologous ribs. And I've published multiple articles about this and done it over 1,000 patients in a long-term follow-up of over a decade. So the key in rhinoplasty has always been the scar tissue and the lack of structural support. And the most important thing is the structural support loss. And that lack of structural support really causes you to deform your whole nose. And that's hard to come back from. So when you're doing a revision rhinoplasty, many times when you've opened up the nose and reshaped it, you need to provide a restoration of the framework. And so how do you do that? You do it with the patient's own septum, or you need another graft. You can go to the ear, the septum, or the rib. And I don't think the ear works very well. It's not strong and structurally supportive, and the septum is many times gone. But if it's there, I use it. But if not, I'll use a rib graft. For many, many years, I used autologous rib. Patients didn't necessarily like that. It's another donor site. It hurts. There's some discomfort in this area. So I found that really trying to find a cartilage graft that's like that, that actually works. There's multiple different arrays. There's a radiated rib, which isn't very good. They basically zap rib grafts, donor rib grafts with radiation, and that really is not a very good option because that resorption rate is much higher, infection rate is higher. But the concept of using a fresh frozen rib is very appealing because that is an area that actually is off the shelf, and you can use it that's not irradiated. It's actually a process that undergoes sterilization, not terminal sterilization, so you preserve the cartilage matrix. It works great. So you preserve the matrix and it allows for normal tissue ingrowth. So I think it's a fantastic option, and that's what I've used. And I think it's fantastic because I can use it in primary and secondary patients for rhinoplasty. It's off the shelf. It's totally biocompatible with your own tissue. It's a human tissue allograft. It's carefully prepared by this company called MTF, and it's aseptically and pre-treated, processing through a very, very, very rigorous pre-treatment sterilization process that's been used and approved by the FDA, and it works beautifully, and I love it. And I'll just share with you my experience on the role of fresh frozen rib. And I select the rib from different types of areas, and again, it comes from MTF, this company that's a nonprofit in New Jersey, and it allows me to select exactly the type of tissue that I like. In this case, I'm looking at tissue that is from the Musculoskeletal Transplant Foundation, and it's a yellowish hue, and that's the type I want. And then I'll sculpt it the way I like it, use it and shape it any way that I want to do it, and I can use it in the dorsum of the rib, in the tip, and in the alar rims, and it works beautifully in that area. And these are just some examples of patients that I've used it in for the dorsum to reshape their nasal dorsum and tip that have not had any type of other donor site, and it works beautifully for these types of patients to not only restore function but also structure, and it works beautifully. The characteristics of fresh frozen rib is similar to that of autologous rib. We've studied this and published it in our journal, and the complication rate for autologous versus fresh frozen, again, is compatible. And again, this is published in our Journal of Plastic and Reconstructive Surgery. And we recently published a 9-year experience with fresh frozen ribs and cartilage grafts and showed that the experience was excellent and that the complication rate was similar to that of autologous rib or even less so. In this database where we got over 400 patients back, we found that the complication rate was very low, and it was a very reliable, safe, long-term rib graft, and allows you to use off-the-shelf and customization of that graft for the dorsum, the tip, and everything else. So I think it's a very, very powerful type of technique and technology that can be used in all types of revision and secondary rhinoplasty patients. I think it maintains structural support long term. It also does it for the dorsum, the tip, and for the alar rims. This happens to be an example of a patient that had that had a collapsed nose, inadequate tip rejection, and really needed structural support. So we did dorsal onlay graft, tip shaping of the alar base and rim, and really reshaped this entire patient. Here she is a long follow-up of her dorsum and alar base and tip, and it just gives you a nice shape and contour. And I think that's really what you want. You want to improve the shape and contour and also improve the function. And sometimes we even use it in primary rhinoplasties if they have thicker skinned patients, the non-Caucasian patient, the weaker septum patient, and a patient like this that has significant convexity of her dorsum but inadequate tip projection and a very weak septum. And of course, these are the types of patients that the septum is used commonly, but if it's weak or inadequate, then we will use a septal extension graft made out of rib, because in this case it wasn't strong enough. So we used the graft that actually helped to shape her dorsum and her tip and gave her a beautiful result. As you can see here, she's got beautiful shape and contour of her dorsum and tip, but her septum was not strong enough, so we used a fresh frozen rib graft in this patient. So same with patients with cleft nasal deformities. They've had multiple different ribs and or septal harvest. So these patients also require complex reconstruction with fresh frozen rib. You can do that in these types of patients where you're restructuring the shape of the dorsum, the tip, and you're augmenting that entire area, the tip, the alar rims. All of this is done with rib grafts. And it works beautifully in these types of patients where you can reshape and restore the contour of these patients, and you can see how incredibly nice the improvement in the contour and the shape of the dorsum and the tip. Another example of a cleft rhinoplasty, the role of this in reshaping the dorsum and the tip is beautiful. So dead space is truly our ultimate enemy, and the way to restore and close dead space is that you have to have a strong nasal framework. And I think that's typified in a patient like this that's had multiple different rhinoplasties, foreshortened nose, alar rim collapse. And in this type of patient, she requires complete structural reconstruction of the dorsum, the tip that's foreshortened, and we will then remove the different types of implants that are in there, restore the columella, restore the dorsum, give her some dorsal augmentation in all dimensions on the dorsum and the tip, reshape her tip, and restore her. Here she is at early post-op at 10 days, and you can see she's got much improved dorsal shape and contour. Here she is at 11 months, and you can see the shape and contour is improved. She now looks better, feels better, and she can breathe and is functional. And I think that's the kind of shape and contour that you like, and this is what's provided with a fresh frozen rib graft. So I think in summary, this is an incredibly great alternative that I use almost every day in revision rhinoplasty. It gives you the ability to select a shape and contour of a rib graft off the shelf that's no donor site, no additional scar, similar track record, if not better, than autologous rib, and it gives you incredibly long-lasting, excellent results. And I think the key here is you can get reproducible consistency and results And that's the most important thing in rhinoplasty, especially when you're doing revision rhinoplasty. So I think it's a very important concept that I think has served us well for well over a decade, and I think it's something that should be part of your armamentarium as a reconstructive rhinoplasty expert as well as a revision rhinoplasty surgeon. So thank you for your time, and hopefully this will help guide you when you're looking to find a rhinoplasty surgeon that can help you to restore your nasal function and aesthetics. Please leave me your comments and thoughts, and until the next episode, enjoy.